Well, I think, the first thing to just acknowledge is that inevitably when we reopen, we are very likely to see more cases. We are not at zero community transmission. We are still seeing cases. We're on the downward part of that slope, but we are still seeing cases. And as we reopen, there will be more contact between people and we will see more cases. It's just about mitigating that risk. There are risks and harms of not reopening as well, not only to the economy, but to people's health in other ways because they're not accessing the healthcare system. So it's all about finding that balance. And I think the report was very correct in that balance is very different in different parts of the province based on how many cases and the type of population in different parts of the province, and also based on differences in healthcare system capacity in different parts of the province. And an example would be a big city like Toronto, where we have lots of homeless shelters, and we're still seeing clusters of cases from homeless shelters compared to some of the smaller towns in Ontario where they don't have nearly as many folks who are homeless and nearly as many, for example, long-term care facilities. And they're not seeing as many cases. They're barely seeing any community transmission in those communities where it would be much safer to open up. So there is this regional disparity.
Let us look to an area where we're seeing not really a cluster, but a large number of cases of COVID-19. This is in new data that is available from Public Health Ontario. It's data that's been provided to CBC News. I'll bring some of these numbers up on the screen for people to understand. This is the alarming numbers, I would use that word, I think, of healthcare workers who have COVID-19. 714 nurses, 76 physicians, 70 first responders, 41 lab workers, and more than 2,700 others, including PSWs, respiratory therapists, and the like. So I used alarming because some of the other physicians to whom we have spoken have used that terminology. But what do you think of these figures, and why is that incidence happening?
The figures are certainly very concerning, and we're also seeing a change in those numbers. Even compared to a month ago, the proportion of cases that are accounted for by healthcare workers is much higher now than it was a month ago. A few reasons this may be happening. If you think about the healthcare setting, we as healthcare workers are taking care of the sickest patients with COVID-19, which means that those patients also have a higher viral load. So we're facing patients with more virus, which creates a higher chance of us catching the virus. We're also dealing in situations where you have an enclosed space and the contact is quite prolonged when you're taking care of a sick patient. So again, that increases your risk. Of course, we balance that risk by using personal protective equipment. The challenge with the PPE side of the story, and we've talked about this on the show before, is that we are facing a changing landscape, ever-changing landscape with respect to our supply of PPE. And that means that our usual protocols for donning and doffing, donning is when you put it on and doffing is when you take it off. And this is really sort of a very carefully choreographed routine that we have. Those routines are being disrupted. We're being asked to change those routines. For example, now we're being asked to preserve our N95 masks. We don't take them off and throw them away, we keep them. In many places, we're being asked to preserve our face shields. We don't throw them away because we don't have enough disposable face shields. We've gone from disposable gowns to reusable gowns. And so this constant changing in the routine is what creates the possibility of making mistakes. So there is a possibility that folks are just not getting into a very safe routine and learning this process and having to relearn it every time there's a rule change, and therefore prone to making mistakes. And if someone does make a mistake, a hospital is not a great environment to prevent spread and to enable that physical distancing.
Yes.
So you have these nursing stations for the ward where it's simply very difficult to physically distance from your colleagues. And then you have many shared surfaces like computers, et cetera. So if one person does make an error, it then becomes quite easy for that infection to spread through various surfaces in that environment.
So I should make it clear, all of those numbers I was getting in terms of numbers of people specifically affected, nurses, physicians, and the like, it's gone from a 10% incidence among healthcare workers to last month 17%. And that was the increase that was alarming to so many and concerning, as you say to yourself, for the reasons that you expressed. But I'm just wondering, there has been such attention paid to ensuring a stable supply of PPE. Maybe that hasn't happened as you suggested, but what else needs to be done then to make sure that the people like you on the front lines are indeed safe?
I think a few things. So we've heard a lot about massive orders of PPE. We've had some supply issues, but then we've also had quality issues. So we've been reading in the papers about massive shipments of N95 masks, for example, that then didn't pass the testing requirements for N95. So there has been a quality issue that's prevented some of this supply from getting into the market. The other piece that we've seen in other parts of the world is a very strategic approach to reusing and sterilizing these N95 masks, and we don't quite have that here yet. So that's just one example, but there's a whole chain of PPE, and it goes beyond N95 masks. It goes to, as I mentioned, face shields and gowns and even gloves, and all of these things need to be stocked adequately. And in some parts of the province, there's really a minimal issue, no major concern. Whereas in other parts of the province where they've seen more cases, we are hitting up against some constraints. And, I haven't heard of any institutions where there's a shortage to the point where folks have had to use, alternates. We still have it, but we are being asked to preserve. And there is this concern when you project forward about making sure that we have enough if there is another surge and if we see more cases coming in as things reopen.